Dr. Jürgen Wolf, can you please summarize in short the most important aspects of your talk here today?
Yeah, it's a pleasure. So during the last 15 years, we have seen really impressive success in molecularly guided therapy in non-small cell lung cancer. And we have also seen that this personalized lung cancer care substantially improves overall survival. And it does not improve overall survival for a few weeks, like we have had the situation in the era of chemotherapy, but 4 years. So 3, 4, 5 year median overall survival times in molecularly defined subgroups is really a large benefit for the patient. And so it's really a disaster situation as the testing rates to enable such personalized therapies for the patients are frustrating and very low. So in registry data from Europe as well as from the US show that around 50% of the patients are not tested for all the mutations. And I think since this, my opinion is that this is one of the major challenges we face in the moment. That all the success, all the progress we see here in our fantastic conferences and in the academic centers should also be brought to the patients who are not treated in academic centers. And this is the majority of the lung cancer patients. So I think this is a major challenge. And there are network models in France, for instance, or also in other countries, also in Germany, where we have established a new work split between academic centers who overtake the responsibility for molecular testing, interpretation of genomic analysis, recommendation, trial access, and so on, while the majority of the patients in close collaborations then can be treated in community hospitals and private practices.
What would you say to Norwegian oncologists that maybe will try to get this into their clinical everyday life to help these patients?
Yeah, this is a good question. So I think each oncologist, for instance, in a smaller community hospital or in a private practice, he should really try to establish a close contact with one of the academic centers to be counseled, to have the opportunity to send tissue for testing, to start discussions, to participate, for instance, in the molecular tumor board of the academic center. I think this is key. Establish a vivid atmosphere of collaboration.
Last question. How will this field look like in, let's say, 10 years?
In 10 years, I'm sure that the percentage of patients undergoing molecular testing will increase, because there is also now a strong pressure from the patients themselves, who organize themselves, and in our country, for instance, in mutation-specific patient groups, and they recommend other patients, the best academic centers, the best second opinion consultation, or they are very well informed about new trials. So I think this will help to move the field forward.
Thank you very much.
Pleasure.